I'm Vic Snyder. I have to say, former family doctor from Arkansas. In October of '91, I was on the grounds of the old State House when a then little-known governor named Bill Clinton announced he was running for presidency. Now, you know, a year later when he won, half of the state of Arkansas said they were on the grounds that day. I was there, and they were. There weren't many of us there that noontime press conference when he made his announcement. But that began a year-long discussion with this country about health care and the need for health care reform, and then began a period of time which we now know very dramatically is the failure of the last major health care reform effort in this country. So what happened? What happened? What has happened in the last 15 years? We have had a reckless experiment with the lives of the American people. We've had a reckless experiment with now there's almost 50 million people without health insurance. By the way, that means those people go without health insurance for a year. It means a reckless experiment with those people who are there part of the year, which I think the Commonwealth Fund estimates as being over 80 million in any given year. A reckless experiment with those who are underinsured, who have gaps in their coverage, who have pre-existing conditions, and when they get sick with what they're most likely to get sick, don't get coverage. A reckless experiment in the richest country in the world. A reckless experiment with small business, where we all say, oh, we're big supporters of small business, and yet we've left them floundering around for 15 years when they were all crying out for help every year since then. When I was a little boy and raised by a single mom, here's what health care was like for me. When you got, of course, when back then, when you got a cold, you had to get a penicillin shot, right? I mean, that treated everything. When your kid got sick, this is what my mom did because we didn't have health insurance. She would put me in the car, drive me down to our friend, a family friend who was a nurse. She would come out with this big syringe of penicillin on the street. My mom would pull down my pants and she'd stick my butt with a penicillin shot. I don't know what was wrong with me. She didn't know what was wrong with me. That's what happened to poor kids. Well, what's the modern equivalent of that? I'll give you one example. We think we're the richest country in the world with tremendous technology. A few months ago, I met a fourth-year medical student, delightful woman. If any of you in here talk to her for 5 minutes, you'd think, as soon as she's in practice, I'm going to see her, going to be a general surgeon. In the course of the discussion, it came out that she has diabetes and she's on insulin. But she's on one of these policies that's provided by her medical school, and this is a fine medical school. You know what student policies are like? They must cover like baseball injuries or something. Well, what they didn't cover and don't cover for her, they don't cover an insulin pump, which is what she needed. So think about it. Hundreds of thousands of dollars being invested in her. We want her to perform for 50 years, and yet we're giving her some substandard care at a leading medical institution. That is a shameful, reckless experiment with the lives of the American people. Well, I'm told that Alex Castellano from the Republican group who's always commenting on CNN came up with this phrase that Republicans should say Obamacare is a risky experiment. He seems like a very nice man. He seems better looking than Anderson Cooper, but probably not as smart as Erica Hill on CNN. But he came out that he's given credit for coming up with the phrase, just say Obamacare is Obama plan, the House plan, whatever it is a risky experiment. Well, in fact, that to me is like Mr. Larson here calling me up as a fire chief and saying, my house is on fire, my house is on fire. And I rush over there and say, we're having a debate over here. We're a little worried that the water might hit your sofa. We've got, 4 out of 10 of members of our fire department think, it's not worth the risk right now. We might get your sofa wet. Well, my own view is there's a lot of, I disagree. I disagree with our doctor. I want people to criticize this plan. I want them to be aired. I want it's in the spirit of making it better. But after we have this debate, whether it's through this month or next month or whenever this is going to end, the shameful, reckless experiment of the richest nation in the world is going to end. And it's going to end under President Obama's leadership. And